Hey there, medical professionals! Today let's dive into the fascinating world of synovial joints and see how they enable your every move. Synovial joints are the most common and most mobile type of joint in our bodies. They're characterized by a synovial cavity filled with synovial fluid. This fluid acts as a lubricant, allowing for smooth, pain-free movement. Now let's break down the types of movements that can occur at these joints, categorized by the nature of the movement and the plane in which it occurs. First up, we have flexion and extension. Flexion decreases the angle between two body parts. Imagine bending your elbow or knee. This typically happens in the sagittal plane. Extension, on the other hand, increases the angle, returning the body part to its original position. Straightening your elbow or knee are perfect examples. And then there's hyperextension, which goes beyond the normal range, like bending your head backward. Next, let's talk about abduction and adduction. Abduction involves moving a body part away from the midline of the body. Think about lifting your arm sideways. This movement takes place in the frontal plane. Adduction is the opposite, moving a body part toward the midline. Lowering your arm back down or bringing your fingers together fit the bill. Moving on to rotation. Medial rotation is when you turn a body part inward toward the midline, like rotating your shoulder or hip inward. Lateral rotation is the opposite, turning a body part outward. Circumduction combines flexion, extension, abduction, and adduction to create a circular, cone-shaped motion. Picture moving your arm in a windmill motion. Let's not forget the special movements. Elevation and depression involve lifting or lowering a body part. Shrugging your shoulders elevates them, while lowering them back down involves depression. Protraction and retraction are about moving a body part forward or backward. Sticking out your jaw or pulling it back are good examples. Opposition and reposition are movements involving the thumb and little finger. Opposition brings them together for grasping, while reposition returns them to their original positions. Pronation and supination describe movements of the forearm. Supination rotates the forearm so your palm faces upward, while pronation rotates it downward. Finally, we have gliding. This movement involves sliding flat bone surfaces over each other, occurring in plane joints like those in the wrist or ankle. These movements are small but essential. Now, for some examples of synovial joints and their movements, ball and socket joints like the shoulder and hip allow for the greatest range of motion, including flexion, extension, abduction, adduction, rotation, and circumduction. Hinge joints, such as the elbow and knee, primarily allow for flexion and extension. Pivot joints, like the atlantoaxial joint in the neck, permit rotation around a single axis. Condyloid joints, like the wrist, allow for flexion, extension, abduction, and adduction, but not rotation. Saddle joints, like the thumb's carpometacarpal joint, enable movements in two planes. Plane joints, like the acromioclavicular joint in the shoulder, allow for gliding movements. Understanding these movements helps us comprehend how our bodies achieve a wide range of motions necessary for daily activities and complex movements. Thanks for tuning in. Make sure to like and subscribe for more insightful videos. See you next time.